Welcome to the Chanel Now. We discuss today what is cancer, how is cancer diagnosed, how does cancer spread. Cancer is a complex and often misunderstood disease that arises from the uncontrolled growth and division of abnormal cells in the body. Normally, human cells grow, divide, and die in an orderly fashion, following instructions encoded in their DNA. However, in the case of cancer, this orderly process breaks down. The cells begin to grow and divide uncontrollably, and they do not die when they should. These abnormal cells can then invade nearby tissues and, in some cases, spread to other parts of the body through the blood and lymph systems. This uncontrolled growth is what makes cancer so dangerous, and it can occur in almost any part of the body. Scientists and medical professionals have identified more than 100 different types of cancer, each classified by the type of cell initially affected. For instance, carcinoma begins in the skin or tissues that line internal organs, while sarcoma originates in bone, cartilage, fat, muscle, or other connective tissues. Leukemia is a cancer of the blood-forming tissues, and lymphoma affects the immune system. The disease can begin almost anywhere in the body and spread rapidly, making early detection and treatment crucial. Cancer develops due to mutations in the DNA within cells. These mutations can be inherited from parents, but more often they are caused by environmental factors such as exposure to carcinogen substances known to cause cancer. Tobacco smoke, ultraviolet radiation from the sun, certain chemicals, and even some viruses and bacteria can all be carcinogens. In some cases, the mutations occur by chance during the normal process of cell division. Over time, as more mutations accumulate, the cells may become cancerous. These mutations affect genes that control cell growth and division. For example, oncogenes promote cell division, and when mutated, they can become hyperactive, pushing cells to divide uncontrollably. On the other hand, tumor suppressor genes normally slow down cell division or trigger cell death. When these are mutated, they may stop functioning, allowing cells to grow unchecked. The process by which a normal cell becomes cancerous is known as carcinogenesis, and it typically occurs in several stages. Initially, a single cell undergoes a genetic mutation. If that mutation gives the cell a growth advantage, it begins to divide more rapidly than its neighbors. As additional mutations occur, the cell becomes more abnormal and gains more growth advantages. Eventually, it may form a tumor, a mass of tissue composed of abnormal cells. Not all tumors are cancerous. Benign tumors do not invade surrounding tissues or spread to other parts of the body, while malignant tumors do. Malignant tumors can destroy nearby tissues and metastasize, or spread, to distant organs, making them far more dangerous. Metastasis is a key feature of cancer and a major reason why it is so difficult to treat once it has progressed. Detecting cancer early significantly improves the chances of successful treatment. There are several methods by which cancer can be detected. These include physical exams, imaging tests, laboratory tests, and biopsies. A physical exam may reveal lumps, skin changes, or other abnormalities. Imaging tests such as X-rays, CT scans, MRI scans, and PET scans allow doctors to see inside the body and identify abnormal masses. Laboratory tests, including blood and urine tests, can reveal abnormal levels of certain substances that may indicate cancer. For example, prostate-specific antigen, PSA, levels are measured to detect prostate cancer, and elevated levels of certain liver enzymes may suggest liver cancer. Biopsy is one of the most definitive ways to diagnose cancer. During a biopsy, a sample of tissue is removed from the body and examined under a microscope. A pathologist looks for abnormal cell structures, growth patterns, and other indicators of cancer. In some cases, additional tests such as immunohistochemistry or genetic testing may be used to confirm the diagnosis and determine the specific type of cancer. Genetic testing can also help identify mutations that may be targeted with specific treatments. For example, some lung cancers have mutations in the EGFR gene that can be targeted with drugs like erlotinib. Advancements in molecular biology have allowed scientists to identify biomarker-specific molecules found in blood, tissues, or other fluids that can help detect cancer early, monitor its progression, and evaluate the effectiveness of treatment. Liquid biopsy is a newer, less invasive technique that analyzes blood samples for circulating tumor DNA, ctDNA, which can provide information about the genetic makeup of the tumor and help guide treatment decisions. This approach is especially useful in detecting cancer recurrence and monitoring response to therapy. Once cancer is diagnosed, it's important to determine the stage of the disease. Staging describes the extent of cancer in the body and is critical for planning treatment. It typically involves assessing the size of the tumor, whether it has spread to nearby lymph nodes, and whether it has metastasized to distant parts of the body. This is often referred to as the TNM system, T for tumor size, N for lymph node involvement, and M for metastasis. The stage may range from stage 0, indicating very early cancer that hasn't spread, to stage 4, indicating advanced cancer that has spread to distant organs. How cancer spreads is a complex and dangerous process. Initially, cancer cells grow within the tissue where they originated. As they accumulate, some cells acquire the ability to invade nearby tissues. This invasion is facilitated by enzymes that break down the surrounding extracellular matrix, allowing cancer cells to migrate. These invasive cells may then enter nearby blood vessels or lymphatic vessels, gaining access to distant parts of the body. Once in circulation, cancer cells face many challenges, including immune system attack and the need to survive in a foreign environment. However, some cells manage to survive and exit the bloodstream at distant sites, e.g. these new sites. Cancer cells must adapt to their environment and begin to grow again, forming secondary tumors. This process is known as metastasis and is responsible for the vast majority of cancer-related deaths. Metastatic tumors can be found in the lungs, liver, bones, brain, and other organs, depending on the type of primary cancer. For example, breast cancer often spreads to bones and lungs, while colon cancer may spread to the liver. The metastatic process is highly inefficient, and most circulating cancer cells do not survive. But those that do can establish new colonies of cancer cells that are often resistant to treatment. The ability of cancer cells to metastasize depends on several factors, including genetic mutations, changes in the surrounding tissue environment, and the presence of certain signaling molecules. One of the hallmarks of cancer is angiogenesis, the ability to stimulate the growth of new blood vessels. Tumors require a blood supply to obtain oxygen and nutrients, and without it, they cannot grow beyond a certain size. Many cancers produce signals that stimulate angiogenesis, allowing them to expand and eventually spread. Anti-angiogenic therapies have been developed to block this process and slow tumor growth, although these treatments are not always effective for all patients. Cancer cells also evade the immune system, which normally identifies and destroys abnormal cells. They do this by producing signals that suppress immune responses or by altering their surface proteins to avoid detection. Immunotherapy is a promising area of cancer treatment that seeks to boost the body's natural defenses to recognize and attack cancer cells. Checkpoint inhibitors, CAR T-cell therapy, and cancer vaccines are all examples of immunotherapies that have shown success in treating certain types of cancer. However, not all patients respond to these treatments, and researchers continue to investigate why some cancers are more immunogenic than others. Chemotherapy, radiation therapy, and surgery remain the cornerstones of cancer treatment. Chemotherapy uses drugs to kill rapidly dividing cells, which includes cancer cells but also affects healthy cells that divide quickly, such as those in the gut and hair follicles. This leads to side effects like nausea, hair loss, and fatigue. Radiation therapy uses high-energy rays to kill cancer cells or shrink tumors, and it can be used alone or in combination with other treatments. Surgery is often used to remove localized tumors and may be curative if the cancer has not spread. Targeted therapies are drugs designed to interfere with specific molecules involved in cancer cell growth and survival. These treatments are often more precise and have fewer side effects than traditional chemotherapy. For example, drugs that target HER2 in breast cancer or BRAF mutations in melanoma have significantly improved outcomes for many patients. Hormone therapies block the effects of hormones that some cancers need to grow, such as estrogen in certain breast cancers or testosterone in prostate cancer. Because every cancer is unique, personalized medicine is becoming increasingly important. By analyzing the genetic and molecular profile of a patient's tumor, Doctors can select the most effective treatments and avoid those unlikely to work. This approach maximizes benefits while minimizing side effects. Clinical trials continue to explore new drugs, combinations, and treatment strategies, offering hope to patients who may not respond to standard therapies. Palliative care, which focuses on relieving symptoms and improving quality of life, is also an essential part of cancer management, especially for patients with advanced disease. In addition to conventional treatment strategies, lifestyle changes can play a supportive role in cancer management. While lifestyle modifications alone cannot cure cancer, they can help patients feel better, manage side effects, and improve overall health. A well-balanced diet rich in fruits, vegetables, whole grains, and lean proteins can strengthen the immune system and aid recovery. Physical activity, when appropriate, can reduce fatigue, improve mood, and enhance physical function. Avoiding tobacco and limiting alcohol intake are also crucial, as both substances are strongly linked to increased cancer risk and can interfere with treatment. Stress management through practices such as mindfulness, meditation, or counseling can support emotional well-being, which is especially important during a long and challenging illness like cancer. Many cancer centers now incorporate integrative oncology programs that include these supportive therapies alongside standard medical care. One critical issue in cancer care is access. Disparities in healthcare mean that not all individuals have the same opportunities for early detection, high-quality treatment, or participation in clinical trials. Socioeconomic status, geographic location, race, ethnicity, and insurance coverage all influence access to timely and effective cancer care. Studies have shown that underserved populations are more likely to be diagnosed at later stages and have poorer outcomes. Addressing these disparities is a key focus of public health initiatives and cancer advocacy organizations. Outreach programs, mobile screening units, and patient navigators are some of the tools being used to reduce barriers and improve equity in cancer care. Public health efforts also play a significant role in cancer prevention. Vaccination against human papillomavirus, HPV, can prevent several types of cancer, including cervical, anal, and oropharyngeal cancers. The hepatitis B vaccine helps protect against liver cancer. Anti-smoking campaigns, workplace safety regulations, and food labeling laws have also contributed to a reduction in certain cancer risks. Continued investment in prevention strategies is essential for reducing the overall burden of cancer and saving lives. Education about warning signs and the importance of screening is another cornerstone of cancer control. While not all cancers are preventable, early detection through regular screenings can catch many cancers in their most treatable stages. Mammograms for breast cancer, Pap tests for cervical cancer, colonoscopies for colorectal cancer, and low-dose CT scans for lung cancer in high-risk populations are all examples of screening tools that save lives. Encouraging people to participate in these screenings requires ongoing public education, community engagement, and support from healthcare providers. Pediatric cancers, while relatively rare, pose unique challenges. Childhood cancers often differ biologically from adult cancers and require specialized treatment approaches. Leukemia, brain tumors, and lymphomas are among the most common cancers in children. Advances in pediatric oncology have led to remarkable improvements in survival rates, but treatment can be intensive and long-lasting, with potential late effects such as growth problems, cognitive issues, and increased risk of second cancers later in life. Survivorship care and long-term follow-up are essential components of pediatric cancer treatment plans. Geriatric oncology is another growing field, as cancer incidence increases with age. Older adults often have different needs, including coexisting health conditions, reduced tolerance to treatment, and unique social support requirements. Personalized treatment planning for elderly patients must consider not only the biology of the cancer but also the overall health, preferences, and goals of the individual. Comprehensive geriatric assessments can help identify the best approach to treatment and improve quality of life. The emotional and psychological impact of cancer cannot be overstated. A cancer diagnosis can trigger a range of emotions, including fear, anger, sadness, and uncertainty. Patients may struggle with changes in body image, relationships, and their sense of identity. Depression and anxiety are common and can interfere with treatment adherence and recovery. Psychosocial support services, including counseling, support groups, and psychiatric care, are essential for addressing the mental health needs of cancer patients and their families. Many cancer centers offer comprehensive support services to help patients cope with these challenges. Family caregivers play an indispensable role in the cancer journey, providing practical help, emotional support, and advocacy. Caregiving can be rewarding but also physically and emotionally demanding. Caregivers often experience stress, fatigue, and financial strain. Recognizing their contributions and offering resources such as respite care, counseling, and caregiver education can improve outcomes for both patients and caregivers. Cancer survivorship begins at diagnosis and continues through the balance of life. Survivors may face a range of physical, emotional, and social challenges long after treatment ends. These can include fatigue, pain, cognitive changes, sexual dysfunction, and fear of recurrence. A survivorship care plan that includes regular follow-up visits, screening for recurrence or secondary cancers, and management of long-term side effects is essential for comprehensive care. Survivorship programs also address vocational rehabilitation, financial counseling, and healthy lifestyle support to help individuals transition back to everyday life. Research is the engine that drives progress in cancer care. Basic science research deepens our understanding of the genetic and molecular mechanisms that drive cancer. Translational research applies this knowledge to develop new diagnostic tools and treatments. Clinical trials are the final step in testing new therapies in humans and are critical for evaluating safety and effectiveness. Participation in clinical trials not only benefits the individual patient but also contributes to medical knowledge and advances that can help future patients. Encouraging greater participation in clinical trials requires education, outreach, and trust building. Particularly among historically underrepresented populations, precision medicine is one of the most promising developments in oncology. By analyzing a tumor's genetic mutations, researchers and clinicians can tailor treatments to the individual patient. This approach increases the likelihood of treatment success and reduces unnecessary side effects. Liquid biopsies, which detect tumor DNA in the bloodstream, are being used to monitor treatment response and detect relapse earlier than traditional imaging. Artificial intelligence and machine learning are also being applied to analyze large datasets, predict treatment outcomes, and identify new drug targets. Cancer genomics has uncovered thousands of mutations that drive different types of cancer. Some of these mutations, like BCR-ABL in chronic myeloid leukemia or ALK rearrangements in non-small cell lung cancer, can be targeted with highly effective drugs. As sequencing technologies become faster and more affordable, whole genome sequencing may become routine in cancer diagnosis and treatment planning. This level of detail helps match patients with therapies that are most likely to work for their specific cancer subtype. The tumor microenvironment, composed of surrounding blood vessels, immune cells, fibroblasts, signaling molecules, and the extracellular matrix, also plays a critical role in cancer development and progression. Some treatments are now targeting the microenvironment to disrupt the support system that tumors rely on. For example, therapies that reprogram tumor-associated macrophages or block immunosuppressive signals can make the environment less favorable for cancer growth and more receptive to immune attack. In recent years, cancer vaccines have shown promise not only for prevention but also as a form of treatment. Therapeutic cancer vaccines aim to stimulate the immune system to attack existing cancer cells. These vaccines are often personalized, created using the patient's own tumor antigens. While still in early stages of development, cancer vaccines may become an important tool in combination with other immunotherapies. As cancer treatment becomes more sophisticated, so does the need for coordinated care. Multidisciplinary teams composed of oncologists, surgeons, radiologists, pathologists, nurses, and other specialists work together to develop and implement comprehensive treatment plans. Tumor boards, where complex cases are discussed among experts from different fields, ensure that patients receive optimal care based on the latest evidence and expert opinion. Global efforts to combat cancer are coordinated through organizations such as the World Health Organization, the Union for International Cancer Control, and National Cancer Institutes. These groups work to improve cancer control strategies worldwide, particularly in low and middle-income countries where access to care is limited. Global cancer initiatives focus on prevention, early detection, training of healthcare professionals, infrastructure development, and public education. Low and middle-income countries often face unique challenges in cancer care. Limited access to screening, diagnostic tools, trained healthcare professionals, and cancer medications leads to delayed diagnoses and lower survival rates. In many regions, cancers are discovered only after they have progressed to advanced stages, where treatment becomes less effective.